I'm Dr. Jeremy Bonzo. I'm a urologist here at King's Daughters Medical Center. You know, usually early on in early stages of prostate cancer, we don't see any signs and symptoms, and that's why it's important to get detected. Early detection is the key, really. Later on in advanced stages of prostate cancer, you can have problems urinating, problems with blood in the urine, back pain. Those are more common symptoms, but most men present without any symptoms at all, and we find prostate cancer because we test for it. Yeah, so there's two tests. There's a digital rectal exam where we actually feel the prostate. There's a PSA test, which is a blood test. Not a perfect test, the best test we have, though, for detecting prostate cancer. Yeah, so we follow the American Urologic Association guidelines, the AUA. As of now, pretty much all men 55 to 69 should be screened. That's kind of the target group. Men who are under 55 who have a higher risk, so that would be men of African American race, men who have a strong family history, especially in first-degree relatives, either with prostate cancer or women in their family with breast and ovarian cancer, pancreas cancer. They're actually recommended to go ahead and to start screening in their 40s, at least with a baseline PSA to see where they're at. Yeah, traditionally we have recommended once a year. There are some recommendations looking at perhaps doing it once every 2 years, which doesn't seem to add any risk to the patient. We still detect cancer. So I would recommend at least once every 2 years, but we traditionally do once every year. Diet may come into play, you know, a healthy diet, fruits and vegetables, avoiding a lot of red meat, a lot of fatty foods high in cholesterol may have a preventative effect, but there's not really any pills, vitamins that men can take. A lot of this is just really, it's really just early detection for most men because of the fact that there's not really a lot of symptoms with prostate cancer, and also kind of knowing your family history. If you know that there are, you know, that you have a brother, you have an uncle, you have, you know, your father had prostate cancer, it's really, you know, checking with your family doctor, getting in with the urologist and getting checked for it. Discuss it with your primary care doctor first. They can do a screening PSA for you and check and see if it's elevated. If they're not comfortable doing the exam or you're wanting to see a specialist, they can refer you over to, you know, one of the urologists, and we can do an examination and discuss the PSA a little further, you know, if the patient has any questions. You know, prostate cancer can be very serious if it's not detected early. Detected early, it has a very high survival rate. Prostate cancer is very slow growing, and actually the problem with prostate cancer treatment has been over-treatment of non-lethal cancer. So what I mean by that is we were treating men who were maybe in their later 70s, 80s with maybe non-aggressive prostate cancers, and they were more likely to die with prostate cancer than from prostate cancer. And so what we need to do is detect that kind of target age group, the 50 to 60-year-old men, early, so that we can treat them with, you know, with radiation surgery. There are different treatment options, but so that we can treat them early before the cancer spreads outside of the prostate. If we catch it early in the prostate, it's very curable. Yeah, so it depends on how aggressive the type of cancer is. The three primary treatments are active surveillance, so there are men who we actually watch the cancer. We check their PSA every 6 months. We do a biopsy every 1 to 2 years, depending, and keep an eye on it as it becomes more aggressive or the patient has more cancer. We may take them for treatment. The two primary treatments are surgery to remove the prostate, which is done by a urologist, and then radiation treatment. There's really no chemotherapy treatment unless we're talking about advanced prostate cancer that's spread outside of the prostate. In that arena, there's a lot of treatments that are coming down the pipeline over the last 10 to 15 years, including pills, some chemotherapy options, and some newer treatments that are being investigated. If patients want to learn more, they can look at the prostate cancer health risk assessment at kingsdaughtershealth.com.